Hello. I think your mic is on mute, so we missed your whole introduction. It looked great. It looked great.
Wow, that's
It
really
looked awesome,
unfortunate.
but we could not hear you. So run that back one more time.
Clearly. Okay, so what I was saying was, hi everybody. My name is Rhyana Ebanks-Babb, and I am based in the UK. Today is my first day streaming for Black Mental Health Matters. Thank you, Linnea, for informing me my mic was off. But things happen, tech happens, we move, and we still go forward. So I was just explaining that a little bit about myself. I am a qualified mental health first aider. I've got over 12 years experience within health and social care within, within the UK. I'm also a youth mentor and I mentor graduates from the from the University of East London. So I'm going to be here joined by Linnea Adamson, who's going to be talking in a great deal in depth about Black maternal health. We're going to be covering a range of topics from morbidity to mothers as well as infant mortality. We're going to be covering what the Strong Black Woman Stroke is, how to get support, depression, a range of different things. And I think it's so vital for these kind of conversations to happen. I, as a mother myself, resonate with a lot of what we're going to be covering. So I likely will jump in with a few of my own personal experiences as well. So that's a little bit about me. I'll hand over to my wonderful, beautiful guest, Linnea Adamson. Welcome, welcome, welcome.
Thank you. So yeah, I'm so excited to have this conversation. As I was researching last night, I was like, it was refueling the fire,
Hmm.
kind of making me upset. The things that we're passionate about are the things that upset us the most.
Hmm. Hmm.
So it definitely reignited a passion.
Yes.
But as she said, my name is Linnea Adamson. I am here in the States in Pittsburgh, Pennsylvania. Um, and my background is in public health and social work.
Hmm.
I started off as a social worker and I found myself treating people after
Hmm.
the fact,
Mm.
after they, had a mental breakdown, or after they became homeless, or after, whatever the situation was. But
Mm.
I wanted to get into prevention. And so
Mm.
that's why I went and added public health in addition to that, because I
Hmm.
wanted to know, how do I prevent this before it happens? And how do I research it? How do I not just come from a place of experience, but
Mm.
also a place of, these are the statistics. This is what the evidence says. This is
Hmm.
what, all the research says. And this is how we go at a problem. This is how we prevent a problem.
Mm.
So I'm a public health social worker, and then I also am a certified birth doula. So I
Yes.
have the experience of actually seeing babies being born, helping Black women birth. And so that's given me a focused view on, or a great experience, firsthand experience on the things that are happening to
Mm.
Black women, that
Hmm.
were just like, oh, it's all in my head. No, it really is happening. And I can see firsthand, if I was not in those spaces, if I was not there as their doula, how
Mm.
their experience would have been different. So we'll talk more about that.
Yes.
And then currently, well, I'll also add that I was a part of an anthology. We published a book called Scenes from a Single Mom. And
Okay.
in that book, the following of that is Love, Loss, Legacy. And I
Mm.
also talk about loss. And so, as a Black woman with a master's degree, I experienced pregnancy loss myself. And so, I'm studying these statistics, I'm studying these disparities, and then I became the
Mm.
disparity.
Mm.
Um,
Mm.
so, it's just from all different sources. I'm really invested in this maternal health topic. And
Yes.
finally, I birthed Linnea Speaks because I wanted to do more. And so, one of the things that I'm working on now is how to help women um, birth spiritually, birth emotionally. And so,
Mm.
taking the skills that I've learned in helping women birth physically,
Mm.
I'm now helping women birth their dreams, their books, their businesses, get unstuck, What do you need in your spiritual birth room? Who do you
Mm.
need in your spiritual birth room? So those are the things that I'm doing right now.
Amazing, amazing. I can see obviously why you're on the show as such a wonderful resource because the wealth of knowledge, the wealth of experience, as well as what you're doing to give back to the community, it's profound, so profound, and very much looking forward to getting stuck into this conversation with you. So, let's kick it off. I know you've mentioned a bit about disparities, and when preparing for this conversation, we was talking a bit about maternal mortality and morbidity. But in your opinion, what contributes to the statistics as well as the actual risk factors within these disparities?
So I have a background in teaching, and so I don't assume that everybody knows what disparity means, that
Mm-hmm.
everybody knows what mortality and what
Mm,
morbidity means. And so I'm just going to quickly break those things down real
perfect.
quick. So, first, when we talk about maternal health, we're talking about the health of a woman during pregnancy, childbirth, and in the postpartum period after she gives birth.
Mm-hmm.
So for Black maternal health, we're talking about Black women, of course.
Mm-hmm.
As far as mortality, that is the death of a woman during pregnancy, at delivery, or after delivery within
Mm-hmm.
that first year. And then when we
Mm,
talk about morbidity, which is, we don't, a lot of us don't talk about morbidity, but those near death experiences,
mm-hmm.
the high blood pressure that women now have after that birth, the near death experience of almost hemorrhaging and almost bleeding to death,
Mm-hmm.
and how that is a traumatic experience. And so we don't always talk about the morbidity of a situation, of those unexpected long-term consequences of what happened in that
Mm-hmm.
childbirth or during that pregnancy, or having a seizure or an aneurysm or anything like that.
Mm,
And so that is important to talk about as well.
yeah.
And then we'll talk about racial disparity. A disparity is just basically a large span, a large difference between numbers. And so when we talk about racially, there is a racial disparity among Black women who are 3 to 4 times more likely to die
Mm-hmm.
in
Mm-hmm.
childbirth than
Mm-hmm.
a white woman.
Mm,
That's huge. And I feel like a lot
absolutely.
of people aren't talking about this. And that's why I'm so excited to have the opportunity to talk about it, because we are losing Black women for mostly preventable reasons,
Yes.
and we don't have to. But we are
Yeah.
literally losing Black women because they decided to
Mm.
have a baby.
Mm-hmm. Mm-hmm.
And that's not okay.
No, not at all. Not at all. And do you know what? It's funny you mentioned that no one's talking about it because this week alone, I know you're referring to mainly US, I'm assuming statistics, but again, in the UK as well, we've got same and similar statistics, which is why it's so important for these um, conversations to happen, not silo in individual countries. So even here in the UK, there's an initiative called Five Times More that speaks on Black maternal health, and it literally speaks on the disparity of Black women being 5 times more likely to go through the same similar experiences, like you said, near death experiences, morbidity rates, infant death rates as well. So it's not a siloed incident or situation, or I would call it even near pandemic, because losing Black people in this kind of rate, it doesn't make sense that it's not being spoken about enough. And yeah, I just wanted to highlight that it's not just where you're based. It seems to be something that is global. And while the disparities will be different in country, the statistics will be different. It is something that once you start looking at the statistics across globally, you'll see that it is a global disparity. So just wanted to highlight that bit there as well.
Yes, thank you. It definitely is a global disparity.
Mm,
And I think in the States or somewhere like UK, you think, that's a developed country. This is not
mm-hmm,
happening here.
mm,
That happens over there. That happens somewhere else. That happens in another country, in another continent. That happens in sub-Saharan Africa, things like that, only there. But literally here in Pittsburgh, we have one of the worst death rates
Wow.
for Black women. And so
Wow.
it should not be dangerous for me to give birth
Mhm.
in Pittsburgh, Pennsylvania.
Mm.
It should not be as dangerous as a developing country, to give birth in
Mm.
the states. It's just unacceptable. And
Mm.
they in our circle, we do call it an epidemic
Mm.
because of the rates of how many Black women are dying when they don't have to. Um,
Mm.
and so, for what I found is that when we think about the numbers, 830 women die globally every day from
And like you said,
childbirth.
they're preventative or they're
Preventable,
preventable. Yeah.
yes. A lot of them are preventable.
Mm.
And so, we'll get into why
Mhm.
they are preventable. But a lot of, when we talk about in the States or in the UK or where I live, the number of hospitals around me,
Mhm.
it's shameful.
Mm.
So why are we still dying when there's hospitals, when there's insurance, when there's medical providers? I have
Mhm.
access to everything that I need. And
Mhm.
so really the only thing that it points to is racial bias, racial discrimination,
Mhm.
silencing Black
Mm.
women, not treating their symptoms,
Mhm.
not listening to them. And so when we talk about one of the things that I saw as a birth doula, I literally played more of a role as an advocate
Mm.
than I did to help that woman actually push her baby out.
Yeah, the delivery
And so,
process.
yeah. And so when we talk about just making sure that that woman is being heard, that
Mm.
her symptoms are being heard, if she says she has a headache, I'm shouting it to the rooftops. I'm not allowing the medical professionals in the room to ignore, what might seem as a little symptom. Oh, that's normal for her to feel that way, but that's not normal for her. And she
Yeah.
knows that. She knows her body. So how
Yeah.
about we listen to mom? And a lot of times those are the things that are ignored, that are signs to high blood pressure, signs to something is going wrong, signs to, you know, something isn't right, but
Mm.
it's ignored.
Mm.
And that is one of the reasons why Black women are dying.
Mm. Gosh, that actually gave me chills. Honestly, it really did. Because I can honestly say, from my own personal experience as well, I've had my son unfortunately accidentally at home, and yeah, even receiving aftercare or even when the ambulance arrived, the lack of empathy, the lack of support. I was young as well. I was 17 when I had my son, so I can understand firsthand where you're coming from in regards to experiences. And also, my mother also passed away shortly after having me. So having that experience of understanding how her death came about and how it could have been prevented, that's why this topic is very close to my heart, honestly. So you've spoken a bit about the contributing factors to maternal health. Let's shift the focus over to infant mortality and infant morbidity. Tell me a bit about your experiences there and the contributing factors to why this is such a large issue and why it needs to be addressed.
So when we talk about both mother and child, of course, the things that come into play are poverty,
Hmm.
young maternal age,
Hmm.
um, distance to medical providers, prenatal care, adequate prenatal care,
Mm.
like at least 4 visits before you give birth, lack of information and knowledge, inadequate services, and um, the lack of cultural practices.
Mm.
Kind of like you said, you were ignored. There was a lack of empathy.
Mm.
And then, who was helping you to say, like, if something was wrong and if you were feeling like, who would you go to if you felt like you weren't heard
Mm.
in one of your most dire needs of having your baby at home? Like
Mm.
that could be and is a traumatic experience. And we're talking about your physical health, but what about your mental health
Mm-hmm. The
of
trauma.
having, the trauma of having had your baby at home?
Mm. That's
Um,
true.
and then personally, I've had an experience with being a doula with a mom who she had her previous child a year prior at home,
Mm.
and she had went to the doctor and was contracting, was 3 centimeters, and they sent her home. So I went and I said, why did they send you home and not to the emergency room? So I went and got her. We went
Mm.
to the emergency room, and then they were still trying to send her home. I said, we're not going home. We might sit in the parking lot, but
Mm.
what we're not going to do is ignore that you are pretty much in active labor. What they're
Mm.
not going to do is send you home to have another baby at home. That's
Mm.
what we're not going to do. And so a lot of times, like I said, a doula is, and a lot of people may not know what a birth doula is. So we'll talk about that as well. But
Yeah.
um, the advocacy part of it, like if you don't have someone who knows kind of the system to know like this is your right, they
Mhm.
can't just send you home.
Mhm.
Um, those are the factors that play into maternal mortality and infant mortality.
Mm.
We're losing moms, we're also losing babies.
Mm.
Miscarriage, stillbirth, infant mortality, Black babies are dying at higher rates. There's a disparity there as well.
Mm. Mm.
And so the fact that we are not getting more attention globally, nationwide on these issues, it just to me says that we don't care about
Yeah. We don't matter.
Black moms, we don't care about Black babies. Like
Mm. It's true.
that's just
It's
my
true.
opinion. Because
Yeah.
if we did, it would be on the news, it would be on CNN, it would be on, we will be talking about it, but we're not.
Mm. And this is why platforms like this are so vital, because it enables that cross country awareness raising of these issues as well. And I know you briefly touched upon stillbirths and miscarriages, but how common, in your opinion, does this happen for Black women or women in general, but then more specifically Black women?
Let me see. Let me pull up my statistics.
Hmm. Came prepared. I like it.
So, it is estimated that approximately 2.7 million newborn babies died in 2015. An additional 2.6 million are stillborn. And a lot of times they don't know, they can't point to a reason
Hmm.
like why a miscarriage happened. They
Hmm.
just tell you to try again.
Mm.
Um, so that's from all women of all ethnic backgrounds.
Hmm.
But what I found was the miscarriage rate for Black women to white women is almost 40% higher.
Mm.
And when I researched the topic, it's like, well, why is that? And, a lot of people pointed to like pre pregnancy health,
Yeah.
like BMI or being obese or
Mm.
having high blood pressure or being in poor health before
Mm.
you're pregnant or, all these other things, but still does not um, explain
Yeah.
the such a high amount.
Yeah.
And so we could talk about, the social determinants of health
Hmm.
and the things that play into, how is my health care across the lifespan? How is my stress level throughout my life? Am I, you know, ducking gunshots,
Mm.
as a youth, and just trauma is just always within me, and is that
Mm.
playing a factor? Is stress playing a factor? Is trauma playing? We can
Mm.
we can point to all these different things, but the point of the matter is that it's there. There's a
Hmm.
40% difference.
Wow.
Um, and so, you know, a lot of women, for me, I found don't talk about it either.
Hmm. Hmm.
If they've experienced a miscarriage or stillbirth because
Yeah.
of stigma
Mm.
attached and the embarrassment. Like, I'm supposed to be fertile. I'm supposed to be able to
Mm.
have a healthy child. So, but such and such or so and so over there is popping out babies,
Mm.
like hotcakes. And what's wrong with me?
Yeah. Yeah.
And especially if I'm not getting the adequate care to find out reasons why, a lot of people point to themselves
Yeah.
as the factor or as the reason that they
Yeah.
had the miscarriage,
Yeah.
instead of this just happened.
internalizing it as, yeah, as them, as it's their fault. I can totally understand that, and it's very shocking, but not shocking that this doesn't get the attention, because again, when we look at the aspects of race and the highlights and the media attention to race specific issues, um it doesn't surprise me that this doesn't get highlighted as much as it should do. um, but yeah, I would like to bring our attention to, you mentioned about a doula. And again, in the beginning, you gave some definitions to disparity, mortality, morbidity. To our audience that doesn't know what a doula is, would you like to give a definition of what a doula is? And then we'll kind of discuss what the difference between a doula and a midwife is and how they interchange, but also could potentially benefit birthing people, birthing mothers, when they're going through that vulnerable experience.
Yes, a lot of people get midwife and doula confused.
Yeah.
Um, and there's a big difference.
Mhm.
And so a midwife is a trained health professional. And
Mhm.
so if we talk to like levels, so an obstetrician gynecologist has gone to medical school. They are there for high risk or, for pregnancies that need to be in a hospital.
Mhm.
A midwife is for those low risk pregnancies where the past pregnancies or past births have there's been no hiccups, there's no high blood pressure, there's little risk
Mhm.
for that woman coming in. There's low BMI, there's just all those factors are in place. So if you have a low risk pregnancy, you can have a midwife who is a trained birth professional. So
Mhm.
they are zeroed in on birth, they're zeroed in on pregnancy, things like that. They know their stuff regarding that. So they can actually catch your baby.
Mm.
And so if anything happens, then they would take you to the hospital, um, for further care.
Mm.
A doula is not a health professional. We do pretty much everything else that is
Mhm.
non-clinical. We are
Mm.
there. Basically, I saw a quote yesterday, we mother the mother. And
Oh, I
so
love that.
yeah, we are zeroed in. Like there's been times where I've put cold washcloth on somebody's head and I
Mm.
fanned her. And
Mm.
she told me that that was like, that made the difference in her
Mm.
birth
Mm.
experience. I'm paying attention. Are you hot? Are you cold? Are you okay? Are you comfortable? Is your pain level? What is your pain level? How are you feeling? How are you
Mm.
doing mentally?
Mm.
Why don't you, try to take a nap in between contractions? Because the nurse professionals, usually a midwife is there pretty consistently. And it's not in a hospital, it might be in a midwife center or somewhere else.
Mhm.
But if you're in a hospital, doctors and nurses are so busy, like they have so many patients, they're not even
Yeah.
in there. Literally, there's been times where they're like, "Oh, we'll be back in 4 hours."
Yeah.
When they have you on the monitor and they're like they're out, they are
Yeah.
monitoring you and they want you to stay in the bed. But what about a woman who wants to be active in her labor and she wants to get up, which and and have gravity help her birth this
Mm.
baby? She doesn't want to just be in the bed. So that's where we come in. We're helping the father, we're helping the partner, we're helping the mother of that person or whoever is a support. We're also helping them because they got to go to the bathroom. They need
Mm.
to eat. They might not know what's happening. They might not know what's going on. So we're explaining medical terminology. We're explaining, like, did you understand that? Do you know what's going on? If
Mm.
someone's in pain, they're not like, number one, they might not be listening.
Mm.
And number two, they're not always voicing their opinion.
Mm. Or
They
they might
might
not
be
even
like,
be corpus mentis to be able to know what they
yeah,
need.
like do
Pain
whatever
riddled in
you
their
want.
body,
I'm just take the pain away. And
literally.
meanwhile, as a doula, we also promote and sit down with the woman before they're in labor to talk about a birth plan. What
Mm.
is it that you desire to have in that room? What smells do you not like? What is
Mm.
your safe word?
Mm.
What is the safe word that you are like, once I say this word, that means give me the epidural now. Until I
Yeah.
say that, I might be in pain, I might be screaming, but I do not want the epidural until I
Mm.
say peanut butter, whatever it is, you know
Yeah.
what I mean? But these are the discussions that we have. And then this is also something that we put on the wall, like,
Hmm.
oh, you, the nurse is trying to get you to do this, or the nurse is trying to, give you an epidural. And it's like, no, she doesn't want an epidural. I know
Mm.
she's screaming right now, but until she tells me, until she looks me in my eye and says peanut butter, or I want, so these are the little things that we as doulas do.
Mm.
And we also talked about, like, what if, a birthing person has a lot of support. I've been in a room where the whole family is there,
Yeah.
like either in the room or in the waiting room,
Yeah.
and I've become a part of the family because they're
Yeah.
just like, and then a lot of times, because it's women of color, they
Mm.
think, they don't believe that I'm actually a doula. They're like, oh, that's just our sister, or she's
Yeah.
calling herself a doula. Like, no, like, I really am a doula. But I become part of the family because I'm helping. They're like, well, explain this to me. Like, I don't understand this. And
Mm.
so even if Oma and Nana and mommy is there, sometimes they bring more stress to
Yes.
the situation. And I'll be like, do you want me to ask them to leave? Do you
And
want me to
that's
say
the advocacy aspect of it as well, whether it is
yes?
the professionals or the family.
Yes. Because I am zeroed in
Mm.
on mom. I am
Yeah.
not there for anybody else,
Yeah.
but to make sure this mom is safe, that she has a healthy and peaceful birth experience, but also that she stays alive.
Yeah. Yeah.
And that is the big thing. And
Mm.
there's been situations where women are alone in their birthing. I mean, they're like, straight up, I don't think anybody should birth alone.
Mm.
And so a lot of people have, families and partners. But for those women that are alone, as a Black woman, no,
Yeah.
there should never be a Black woman giving birth alone, period.
Yeah.
And so that's where we step in as well.
Yeah. Because giving birth is a very scary experience in itself, let alone being alone. I wouldn't be able to fathom what that feels like emotionally, mentally, what physically is happening in your body, if you know it's right, even. So yeah, that's profound. And even you just explaining it, it brings me back to when I was supporting a family member going through their birthing experience. And I guess in a way, I was acting as a doula. Without knowing that I was being a doula, making sure that she was okay, making sure that she, if she needed to eat something, what smells, all that kind of removing things that she like, triggered certain emotions in her that weren't helpful for the experience. So yeah, explaining it definitely gives more insight into what doulas do and the difference between a doula and a midwife. And I find it funny that you mentioned about family and aunts and grandma, and they could all be there and potentially add more pressure to the situation. Well, you should do it this way. I did it that way. You should do it that way. This works well. And
Yes.
all those voices. I can imagine being quite stressful and difficult. So, how active do you think family members should be involved when there are midwives and doulas? Like, in your opinion, how active can family be?
I definitely think that, you know, there's room for everyone
Mm.
if mom is the focus.
Mm.
Everyone can work together. And a lot
Mm.
of times, like, I don't want to take the place of your support system.
Mm.
I want to be the backup role. And
Mm.
so our job is not to take the place of mom, not to take the place of grandma or husband or partner, whoever. Our place is to support whatever that person needs, um, to have a healthy birth. And
Mm.
so I might say, Dad, come on over here. And this is how she might need to be held. Like, hold her on her back this
Mm.
way,
Mm.
or do this, or whatever that may be. So the goal is for everyone to be working together. And
Mm.
so where does someone find a doula? um, Unfortunately, doulas are not given kind of like the credit that is due.
Mhm.
It's almost like been an organic thing in the Black community where we are fighting for it,
Mhm.
because previously doulas have been something that only the well-to-do, like only people who have the money to pay for a doula could get one. And so it's
Mm.
like only white women get that who can pay out of pocket for
Right.
that. And so, at least in the States, at least where I am, there's a lot of nonprofits, there's a lot of community places, there's a lot of Black women, Black doulas who are training other Black doulas
Mm.
who are like, this is an issue. We are dying in childbirth. So, this is what we're going to do. We're going to train each other.
Mhm.
We're going to get trained. We're going to get certified so that we can keep our moms alive. And so, there's um, places like I used to work for a place where we give women free doulas. And
Lovely.
so if they have low income,
Mm.
you can apply or you can get a doula. Some insurances cover it. We
Mhm.
are lobbying for more insurances to cover
Mm.
having a doula and getting paid for that, or having a doula being paid for, or you can pay out of pocket. A
Okay.
lot of people don't have, 1,000 or 500 to $4,000 to really invest in that.
Mhm.
Some insurances pay, and then you can get some from like nonprofits or from the community. Um, you can get a doula that way.
Okay.
Um, what else did I want to say about that? I forget, but it'll come back to me.
That's fine. That's fine. That's really insightful because I think I know we're going to get to the resources question towards the end, but having an understanding of where to find support and intervention is so important because yeah, we know that when it comes to asking for help or asking for what we need, Black women very much don't. But we'll get into that a little later. But just wanted to bring the conversation back to addressing maternal and infant mortality and morbidity. Have you seen any specific research, either in the US or other countries, that are doing work well, or the status of their work has made any significant strides and improvement in these issues affecting Black women and children? Um, has there been any specific research you can share with us, or initiatives that you can share with us, either in your country or worldwide?
I'm looking for it. I know I got some information on that.
That's fine.
Off the
Take
top of
your time.
my head, there are um, places that are lowering the number of mortality or Black women dying in childbirth. Unfortunately, it's not the United States.
Hmm.
We are one of the only. Don't quote me, but I think we are one of the worst developed countries regarding our rates are just horrible. We are
Mm,
one of the only developed countries where our rates are getting worse.
gosh.
So there are other places that are actually finding the importance of doulas,
Hmm.
finding the importance of midwives. In other countries, one of the things that they're doing is training women, women in the community that play that role of a
Hmm.
midwife. They're training them and not
Mm,
just saying, well, you're not a medical professional, you can't. But a midwife is better than nothing.
yeah.
So if the mother of the tribe, or the mother, that whoever plays that role in that community, is now getting trained to know,
Mm,
like, okay, this is too much, this woman is bleeding too much, the baby's coming out feet first, et cetera, et
hmm.
cetera. And so now midwives are being trained where there's a lack of medical professionals, and so that is making a
Mm,
big difference in other countries. um,
mm,
so there are countries that are lowering the number because they are recognizing that there's a problem. I, I
mm,
honestly think that in our country, I feel like with our vice president, we now have a Black Maternal Health Week that
Mhm.
starts April
Woo.
11th to the 17th. Right.
Yeah.
Finally,
I know. I know.
2021. Um,
Yeah.
but I feel like previously we're just like, we're not going to acknowledge that. So how can we work on something to make it better if we won't even acknowledge that it's a problem?
Yeah.
So I feel like
Absolutely.
places and countries that have acknowledged like this is an issue, this is a big problem, they have decreased the numbers over the years
Yeah.
of by making places equitable,
Mhm.
hospitals acknowledging that there is a disparity, acknowledging that there is racial discrimination, acknowledging that there is racial bias. Those
Mhm.
places that are doing that, that's where we're seeing the needle go down.
Mm. Mm. And I can even
When
speak over here as well, the UK understanding of shining light on this attention. So we also have a Black Maternal Health Week over here. I believe it's November, which started in 2020, following again the same campaign, 5 times more, presenting information to our ministers, and that ignited the first attention or awareness week that was so needed. But each year it's developed and it's provided recommendations to how our NHS service and other health organizations can influence and impact the lowering of these disparities as well. And actually, this week there was a publication from the NHS Race Observatory that discussed some recommendations that need to be implemented in the NHS strategy around culturally appropriate midwifing and culturally appropriate birthing. Um, Little skeptical about it, as you would, but at the same time, it's a step in the right direction, because before it was just okay. Well, we know the framework of what we do, but having the interventions from community services, religious places, spiritual places, and key people within community organizations, that has spurred on this development of this framework as well. So I'm seeing some positive move, and even in decreasing, whilst that report was issued in 2020, I believe last year, it then reduced down to 4 times more. So whilst it's still a high disparity, we can see that it is lowering over time. So yeah, thank you for that. Thank you very much for that. And so we've spoken quite a lot about morbidity, mortality. We've spoken about the difference between a midwife and a doula. We've spoken about other countries as well. But I want to kind of go into a bit more depth of your own personal experience, if that's okay, because I know you've mentioned about lived experience of going through stillbirth yourself. Would you like to share a bit more light about your situation with our audience?
Sure. And so I've experienced actually three uh, birth or three losses, pregnancy losses.
Wow.
Technically, three miscarriages
Mhm.
um, over a span of maybe 15 years.
Wow.
Currently 38 years old. Um, and so, it's been a journey.
Mhm.
And so now, if I were to become pregnant, I'm now high risk.
Mhm.
I am now, what do they call it? Geriatric. I'm almost a geriatric pregnancy,
Mm.
um, nearing 40, and so that heightens the risk as well.
Mm.
In my experience, two of the miscarriages happened around like 6 weeks.
Mm.
Sometimes, some women might not even have known that they were pregnant, but
Mm.
because I kind of paid attention, I'm in the health realm, I
Mhm.
knew like something is different, something is wrong. So I took a pregnancy test like right away, and that's
Mhm.
why I knew. And so those were early pregnancy losses or early miscarriages. And so for that, the doctors are kind of like, we don't know, this just happens. It's pretty regular. Um, a lot of women go through this, et cetera, et cetera. My second pregnancy, though, I lost him at 18 weeks. And so
Mm.
technically a stillbirth is not um, until 20 weeks pregnant,
Mhm.
but I call that a stillbirth for me because I pushed him out and I met my baby.
Mm.
And so technically it was a miscarriage, but I call it a stillbirth because I actually saw him, I pushed him out, etc.
Mm.
But because it was so early, his lungs weren't even developed enough for there to be any type of intervention. And
Mm.
so for that one, they're kind of like, like what happened there? You were, 4.5 months pregnant, like, and your water just broke.
Mm.
And so because I don't have, Cadillac insurance, I have not yet gone to get all the tests that need to be done.
Mhm.
As of right now, I have no answers. It's
Right.
just these things just happen. Um, for whatever reason, the pregnancy just did not continue. And so that's been my experience, which also leads into the topic of when we talk about Black maternal health, when we talk about postpartum depression, when we talk about
Mhm.
depression and things like that. Like, of all the things that we have to deal with, a lot of times we as Black women don't talk about our mental health and our self
Yeah.
care, that
Absolutely.
trauma, there's, the things that we experience, it does affect our mental health and we are left with anxiety,
Yeah.
depression. I'm now 38 and I'm like, I miss my babies. I want to be a mother and
Mm.
am faced with that reality of like, will I be able to have a healthy pregnancy? And
Mm.
so these are things that, impact my mental health.
Yeah.
Um, and so it's important not to ignore the whole of the Black woman as well.
Absolutely. Absolutely. And thank you for sharing that, because I can imagine it's very difficult being able to not only share your experience, but the support or lack of support that you've been able to get, I guess, in itself. Um, definitely a difficulty. And going on to the trauma side of it as well, I think when it comes down to any form of maternal support in regards to needing mental health intervention, whether it has been through going through full term and having the baby, whether it's stillbirth or miscarriage, I think there needs to be some form of talking therapy or psychological intervention afforded to the woman, because yeah, it's very traumatic. It's a very vulnerable part of your life that sometimes you need to close the chapter on in order for you to move on from. So um, I know we've spoken a bit about whether Black women actually go and get the support. Sometimes the information is there, we don't know where to get it, or the access to getting that support is not afforded to us. Um, or sometimes we just don't think we need the help. And a lot of us would refer to this as the strong Black woman complex, feeling like we can carry the weight of the world on us. Even when we go through traumatic experiences, such as one that you've explained, we just still have to look after the house, look after the family, get on with it, go to work, and act as if it doesn't affect us. And in your opinion, how do you think the strong Black woman complex, well, I'm not even going to say help, but prevents you from seeking help, so to speak?
Yeah, I definitely feel like that's a great question. Because when we talk about like Black Superwoman, it's
Mm,
like, especially in the workplace,
mm,
I've worked in a lot of in most situations I've worked 5 times harder to get where I am. So
mm-hmm,
I can't show weakness. I
mm,
can't show that I'm tired. I can't
mm,
show that things are, bothering me. I can't show that what I saw on the news
yeah.
of a Black child being killed has taken a toll. Like, I'm not allowed for that. That's not allowed to affect me in
Mm,
the workplace because I have to hold up this standard, and then I have to go home and take care of my partner. I have to go home and
mm-hmm,
take care of my kids. And when do I have time to take the cape off?
mm,
Am
mm-hmm,
I allowed to take the cape off? Because our history has been so hard for so long and we fought. We had to be strong. And
mm,
so we have that that history of strength,
Mm. Mm.
which helped us to survive.
Mm.
But now we can take the cape off, but we don't know how. We haven't been taught how.
Exactly.
And so we almost have to teach ourselves and teach each other, like, it's okay to not be okay.
Yeah.
We're not okay, but no one tells us that it's okay to
Mm.
take a break, that it's okay. And then it's almost like we don't until we have a breakdown.
Mm.
And so after I had um, my miscarriage, the the one at 18 weeks, going back to work, I worked with
Mhm.
pregnant women. I worked with moms and families. And so everywhere I looked was a trigger.
Mm.
It was like babies in my face, babies on the wall, moms coming in, breastfeeding here. And it was just a reminder that I did not have my baby.
Mm.
And
Mm.
so I had to take time off. And so when
Yeah.
things like FMLA, like Family Medical Leave Act, I
Okay.
took time off. Because I am in the field of mental health. I know the importance of taking, like, before I had a breakdown, before I was like, I can't do this,
Mhm.
I took time off to take care
Yeah.
of myself. But a lot of women either don't or don't
Mm.
have the opportunity to. They don't have FMLA. They don't have,
Yeah.
if that woman lost a baby and they're working at McDonald's or they're working somewhere where there's not benefits like that, when
Yep.
do they take time off? When do
Yeah.
they take care of themselves? If they have other children at home, when do they have time to do that?
Yeah.
And so when we talk about the Black superwoman complex, we're talking about having to be strong, suppressing emotions,
Mhm.
resisting being vulnerable,
Mhm.
having to be independent. I
Mm.
can do this on my own. I have to succeed despite not having all the resources. I have to pull myself up by my
Mhm.
bootstraps. And
Mm.
within all that, I still have to be available to help others at
Yeah.
work, at my family, my partner. And also, I can't show that I'm upset.
I was gonna say you have to do it all with a smile at the end of
Right.
the day as well.
Because what I don't want is to be labeled the angry Black woman
Exactly.
or
Exactly.
the person with the resting bee face.
Mhm. Mm. Yeah. Yeah. Yes. Yes. And more yeses to everything you just said there. Again, can totally resonate. I'm seeing lots of comments actually in the chat. I'll go through them shortly as well. Okay, so we've spoken a bit about advocacy in this topic, and you mentioned it mainly with Jula, and this is kind of my field as well. So I work for a human rights and advocacy charity, purely because, again, understanding the system enables you to navigate the system, and then supporting others to navigate the system is where I find my peace, my solace, my ability to give back to my community, in all honesty. So tell me a bit more about maternal health care and advocacy around this subject matter.
So I am not heavily in the field of advocacy. I'm kind of like, in the field.
Mm-hmm.
Um, but a lot of things, like I said, we are trying to improve healthcare so that women are not just, like, I think women are given Medicaid while they're pregnant,
Mm-hmm.
and I think 2 months after the baby's born. Don't quote me, but we're lobbying for longer,
Mm-hmm.
because women can die, or women can have issues. Women need support. Women need health care for longer than that. And so if all of a sudden I just had this newborn baby,
Mm-hmm.
I'm stressed. I haven't gone to my postnatal or my after having childbirth medical appointment
Mm-hmm.
in a couple months. I can't even go
Mm-hmm.
and see about myself. So if something's wrong, it might get overlooked,
Yeah.
because of lack of healthcare.
Yeah.
So at least in the states, that's one of the things that we are lobbying for. Like I said before, um, having insurance company cover doulas. What we found, the stats are that if a woman has a doula, she is less likely to get pain medication. She is less likely
Oh
to have an
wow.
epidural. And so you would think insurance companies are like, oh, we are saving money. If we invest in doulas in the long run, we're saving money because the doula is helping the mom
Mhm.
for whatever, for a myriad of reasons, not get a C-section,
Mm, mm.
not escalate at that point, which costs more money. And so
Yeah.
you would think, but we don't always do things that make sense. And so some of the things, those are some of the things that we are lobbying for, is for these things to be covered.
Mm,
Um, there have been strides, at least in the U.S., there have been strides um, with the Affordable Care Act and things like that.
mm,
But there's definitely more that can be done. And out of the states, like I said, making sure that more women are trained to know the signs. If
mhm,
that person is helping a mother birth, at least
mm.
having the training of like, let's wash our hands, let's have a clean environment, let's
Yeah.
um, know what the signs are with things are going wrong, etc. Um, that those little things are making really big differences.
Mm, mm. I can definitely resonate with that, and I think some of the work that we've been doing over here in the UK relate strongly to developing self advocacy and robust complaint procedures as well, ensuring people know who to go to when things go wrong, or when even when things before things go completely bad, how they can be prevented and what steps are needed to be put in place before it gets to that point of crisis. That's definitely some of the things that we've been looking at, because again, a lot of the time people don't have the resources, but they're very capable to self advocate, but just don't know the information on where to go, what to do, and the actual processes. And a lot of the time, people aren't listened to when it comes down to them self advocating. So that's when people like us come into the picture to advocate on a person's behalf, because unfortunately, despite them being the patient, they don't get listened to, but they will listen to other professionals. And we're not in that person's body experiencing what they're experiencing, but the emotive pain that we or the relational pain that we can feel, um either through our own personal experience, but also just knowing the system on what to do, we're able to better support those individuals as well. So thank you for that. Thank you for that. um so as we're rounding up, tell us a bit about where people can find further learnings, further information for their own learning, sorry, and any upcoming projects that you might be working on as well.
Definitely. So, the places, that you can find research, statistics, like I said, evidence-based studies, things that work. Of course, NIH,
Hmm.
CDC has
Hmm.
information, but a lot of grassroots organization and businesses are doing great work.
Hmm.
You can find a lot of these women, a lot of these people on like Instagram, Facebook, like Black Mamas Matter Alliance, Black Women's Health Imperative,
Hmm.
National Birth Equity Collaborative, and even Mama Glow. These are some of the things that, off the top of my head, I can think of that are doing great work and that are trying to move the needle in
Hmm.
this area.
Hmm.
As far as some of the things that I'm doing, I am stepping out of the actual labor room
Hmm.
and trying to help women, like you said, not self silence, find
Hmm.
their voice, even when we're not, if we feel pain and we're not being treated right, sometimes because we don't want to be viewed as difficult
Hmm.
or the angry Black woman, we don't say anything and we don't speak up for ourselves.
The
So,
troublemakers.
exactly. And so I am launching a coaching program called Birth the Vision,
Hmm.
and I can be reached on social media platforms through Linnea Speaks, exactly how my name is spelled, just speaks at the end. That's how I can be reached everywhere. My
Mm-hmm.
website is www.lineaspeaks.com.
Yeah.
So those are
Mm,
some of the things that are coming from me. I'm always
lovely.
available to speak about trauma, mental health, um, depression,
Mm,
and especially maternal and child health, but also helping women get unstuck just in their life, period, to live a life where they are healthy, live a life of peace and purpose and things like that. So those are some of the things that I'm doing and how I can
beautiful.
be reached. So I love talking with Black women about Black women. I love, and I'm so thankful for the opportunity to have this platform to talk
Yes,
about this important topic. I think that these are some of the things that we can do to bring focus to the topic, to bring it up,
absolutely.
to have conversations of, I didn't know that it was that bad. I didn't know that this was happening. And
Mm-hmm.
so I think the things that we're doing as well um, helps to bring focus on the issue.
Absolutely, absolutely. And moving on from that, just some last final comments that I could see in the chat. So I'll show some of them. So we've got thank you for hosting this topic. Already have a full page of notes. As a male, never ever considered these topics. Yeah. I've got another one here. Please share a follow up on what lobbying is being done in the US. I would like to know more about this. So, Maurice, I'm sure with your note taking, Linnea's given some great pieces of information here. Um, we've got a great topic. Sorry for your loss. Thank you for sharing your experience. Very, very profound. Thank you as well, Linnea. And one last one here. Very powerful and important discussion. Thanks for sharing and opening up. So, Linnea, we have spoken in depth, and I just want to round this off with saying thank you so much for joining me and being my first guest on Black Mental Health Matters and sharing your experiences and knowledge on this very, very important topic. Please, please keep doing the work that you're doing. It is making an impact, honestly, even if it's just on one person, you know that you've made a difference. And to anyone else that is out there experiencing anything, reach out, ask for help. You are worthy of the support. And yeah, this information is going to be here for a lifetime. So refer back to the link if you need to, if there's anything that you might have missed or if you joined a little late, start from the beginning. And yeah, do a bit more research to up your knowledge on this subject. Pass the information on to anyone that you know that needs this help, because this is how we develop our learnings, develop our understandings. As they say, each one teach one. And that's it from me. You'll be able to find me on LinkedIn, Facebook, and Instagram under Rhyana Ebanks-Babb as well. So, Linnea, thank you very much. Much love. Have a beautiful rest of your day. And this is me saying goodbye. All right.
Bye.
Thank you. Take care. Bye bye.